India's capital, New Delhi, is facing a shortage of hospital beds and oxygen as cases there continue to surge. The city has recorded 24,000 infections in just the past 24 hours. Officials say almost 1 in 4 tests were positive. Weekend curfews are in place to try and stem the infection rate. New Delhi is one of the worst hit cities in India and is experiencing a major second wave of the virus. Well, let's get some insight on exactly what's happening with the coronavirus pandemic by speaking to Dr. Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter Medical School in the UK, and he's joining us now live. Dr. Pankhania, always good to speak with you, sir. Now, let's first talk about India reporting over 200,000 new cases despite those vaccination numbers. What's changed there? What's responsible for this increase?
I think it is a failure of politics. India did really well, and now that it has started to enter election cycles, they have dropped their guard. So they allowed festivals like Holi to go ahead. Then they started to allow the opening up of businesses and the crowded buses, trains, transport systems, and then festivals like the Kumbh Mela at the banks of the river Ganges. All of those allow people to do things when they are in the middle of trying to get elected, has caused the surge in number of cases, and this is what we are now seeing.
And just explain, Dr. Pankhania, for anyone who hasn't been paying attention, just how dangerous these mass gathering events really are, especially in a place like India where there is so much transport among regions.
Indeed. So this is a person-to-person spread of infection. So it is not really rocket science. The more you come into close proximity with other human beings, the greater the chances of infection. And furthermore, we now have a lot of evidence that this is also aerosol spread. So when you are on a crowded train, bus, crowded places, and India is a highly crowded country, the transmission by the aerosol route also takes place. And when you're not wearing good quality masks properly, infections do take place.
Certainly a concerning situation in India, but let's look more broadly now, Doctor, if we can. And we've seen rising case numbers in Chile, even though a large proportion of the population have now been vaccinated. Can you explain why that's happening? We didn't seem to see that happening in Israel after a successful vaccination drive there.
So again, it is an issue of the people who are fully protected can still get mild to moderate infection. And this is a key element of the vaccine that people need to understand, which is it prevents you from dying by preventing severe illness. On the other hand, it can give you mild to moderate infection, and then you go on to transmit it to people who have not been immunized at all. And then when you have dropped your guard, again, person-to-person spread, aerosol spread, you get your surge in number of cases.
We've all really got to be careful about this, haven't we? And then finally, Dr. Pankhania, let's look at Brazil. We're seeing reports there, concerning reports, that intensive care units are filling up with people under the age of 40. Can you explain why there seems to have been a change in the patient profile in Brazil specifically?
So Brazil is a tragedy. It is a tragedy, and I hope that the people of Brazil will hold the president to account, because a year ago on TRT, I was saying that Brazil is mismanaging it. And here we are. So with respect to the coronavirus, it will affect anyone. It is a pandemic strain. And when you have a young population, as Brazil does, and you are not being told by your government to protect yourself and have your infection control measures, anyone in any age group can get infected. And we are now seeing worldwide the younger age groups entering intensive care units because they have got infected and they've got severe illness.
And of course, this has been, I think, quite a doom-laden interview that we've had so far, Dr. Pankhania. But let's look at some of the positives. We've seen huge numbers of vaccinations being carried out around the world. In the United Kingdom, there's been a good result in terms of vaccinations and the case numbers. What are we seeing positive to take from this moment in the pandemic?
So the natural history of all pandemics is eventually they peter out. So have hope and don't be gloom-laden. What we have to say is this is the long term, and we are so lucky on planet Earth to have invented vaccines. And the vaccines is one tool out of this mire. So we continue with infection control measures and we continue with immunizing at pace. Unfortunately, the AstraZeneca type vaccines have had a little bit of a concern with blood clots. But to be honest, the risk from blood clots is very, very low. Therefore, my advice would be get immunized as soon as your turn comes. But more importantly, I want world leaders to tell the vaccine manufacturers, drop your patents now. We will reward you sufficiently. We will give you a lot of money in royalties, but allow us to have the plants to make extra vaccines so that we can immunize many, many people as quickly as possible. That is the way out.
A really important final point there, Dr. Pankani. There are calls globally to try and get those patents reduced. I think it's going through the World Trade Organization as we speak. Let's hope that world leaders can come up with a solution. Okay. Dr. Bharat Pankhania, always good to have your expertise. Thank you for being with us. Thank you very much.